Good afternoon from the United Nations University International Institute for Global Health, based at the HCTM Hospital of University Kebangsaan, Malaysia. My name is Pascal Alate, and I'm the director here at UNU-IIGH. This is the second webinar of the Working Local, Thinking Global series that is coordinated with the United Nations Resident Coordinator's Office and hosted by the United Nations University International Institute for Global Health. The series was set up as a mechanism through which the various UN agencies could communicate directly with academics, with civil society, with government and policymakers, and the general public in Malaysia. We have the usual messages for you about engaging within the series and with this discussion in particular. So we will have a presentation today from UNFPA, followed by some discussions and questions and answers. So could you please start off by introducing yourselves through the chat function? Could you also, let us know who you are and have your questions ready. Please make sure you keep yourselves muted so that we are not disturbed and we can focus and listen to the discussion. And please make sure that you enjoy yourself. We have a very exciting presentation today. So I am delighted to introduce to you today Dr. Åsa Torkelson, who joined UNFPA as the country representative for Malaysia and the country director for Thailand in November of last year. And she came to us from an assignment as the UNFPA representative in Bangladesh, where she led and grew one of UNFPA's largest operations and teams through significant changes, humanitarian and natural disasters, the Rohingya refugee crisis, and the COVID crisis. Now, Dr. Torkelson, I'm going to embarrass her a little bit, has a Midas touch. So during her tenure, the country office mobilized resources well beyond the targets, attracted new donors, pioneered strategic partnerships, notably with the World Bank, and amalgamated ICPD innovatively into new programming. Dr. Torkelson's career spans 20 years, leading increasingly complex endeavors at country, regional, and headquarters level across the UN, academia, government, NGO, and private sectors. Also is relentless in pursuing gender equality and SDGs and expanding spaces for women. So it's absolutely apt that we're having this presentation in March, given we have the International Women's Day that has just passed last week on the 8th of March. Now, this has continued the work that she has started with UN. She used to be with UN Women, and she's worked in Africa, the Asia-Pacific region, and Southern Asia. With a PhD in sociology from the University of Stockholm, a Master's of Science in Development Economics from Gothenburg School of Business and Commercial Law, Dr. Torkelson has authored and co-authored several publications on gender equality and women's empowerment. She has already placed her unique stamp on the office here in Malaysia, and you are about to hear about all of that firsthand. Åsa, you have the floor.
Thank you very much, Professor and Director Pascal Alate, for this warm welcome. And I'm really delighted that so many of you have logged on to the meeting this afternoon. So I wanted to start with a few words to remind ourselves that the Sustainable Development Goals are not a distant dream. They are actually a pressing target. And today I was counting on the 17th of March, 2022, we have 2,996 days to reach the SDGs and the Agenda 2030. That is 71,904 hours. By the end of this meeting, we will have 1 hour less to go. In the meantime, as you know, progress is being made and challenges are appearing on the way. New opportunities and energies emerge. And I will, in this coming 20 minutes, talk about how UNFPA in Malaysia is working towards reaching the urgent goal. And I will really do my best to make your time worthwhile in the hope that it can accelerate action. We have no time to lose. As many of you are familiar, UNFPA is the United Nations Reproductive Health Agency. Its literal acronym spells United Nations Population Fund. We are working across the 17 SDGs, but if you look at the circle, we are more pronouncedly targeting our efforts on the health, the SDG 3, and the SDG 5, which is on gender equality. Those of you who are very familiar with our mandate, you will know that the UNFPA is really working with a laser-sharp focus on ending unmet need for family planning, eliminating preventable maternal death, and also eliminating gender-based violence. Those are our focus areas. As you will know, also globally and worldwide, so when we think about the topic of thinking globally, where our minds are on the global agenda, our minds are centered and anchored in the framework of the Sustainable Development Goals. And more specifically for UNFPA, we are then anchored in our strategic plan. And those of you who you will know that our strategic plan actually is starting from 2022, going to 2025 globally. And we are remaining true to our agenda, namely to close in on the unfinished agenda from the ICPD and on the 3 zeros in particular. But in addition, I think it's worthwhile to mention that we are launching the concept of bodily autonomy. And I'm not sure if you're familiar with it, but that means women's, girls' rights to own and make the decisions around our own bodies. And we really do think and are convinced that this will also determine how we can live our lives fully and explore and enjoy all the benefits, regardless of being a girl or a woman. Let me see where we are on the presentation slide. So we can move maybe Nadia, and thank you for helping me here, to the next slide, please. So for UNFPA Malaysia, which is where I'm going to be centering my presentation, I want to situate, therefore, where we are globally in our thinking to where our action is today in Malaysia and where our action is centered around. So just to recapitulate for you, I think many of you may have taken part in the consultations leading up to our current country program document, which was approved actually for the period 2022 through to 2025 in February of this year. Of course, it resonates very loudly and clearly with the Malaysia 12th Plan and the Prosperity Vision and so on. But it's also important to know that it's been developed in a broad consultative process to make sure that we hone in on our support to the government in the unfinished business as identified in Malaysia specifically. And in this context, what you will see is also that we are going to be staying very closely on the topic of ending unmet need for family planning. That means also launching and cascading further, actually accelerating information and access to sexual and reproductive health services and rights, because we particularly see an unmet need in the group of adolescents. We will intensify our work on comprehensive sexuality education, working closely with the government and other partners. And in addition, we will also hone in on moving towards ending gender-based violence. As you all know, Malaysia is an upper middle income country. However, gender-based violence worldwide, unfortunately, it's distributed and it's pronounced in most countries, including what you will have seen in recent media, that there have been increases taking place as GBV can be labeled shadow pandemic to the COVID pandemic. However, what we do see in Malaysia is that there is a need for a consolidation of different data sources. So whereas we have pretty good data and a pretty good basis for policy dialogue in the area of sexual and reproductive health as UNFPA together with our partners, including United Nations University. In terms of GBV, we will have to make more effort. Nadia, if you can help me to next slide, please. So I also wanted to introduce you to our team. In Malaysia right now, we are 7 persons. We are located in Putrajaya. You see here on the screen also the tags and the addresses of our virtual spaces, our social media, where we hope you will be able to engage with us and propose ideas that you may have for our work going forward. Right now, and I'm going to give you just a few brief examples of our work, because having launched the new country program document, it means that this is the very intense process in which we are developing our country program action plan. We call it CPAP. And it's going to be ready for government's approval by June. So it's an intense period for us. We are going to be liaising, networking with many of you to hear your voices and views on where our efforts should be. But just to give you a little bit of flavor of the work that we do, and one of the important areas is, of course, to yield the evidence towards our 3 zeros, namely to provide universal sexual and reproductive health and rights, and also end GBV, gender-based violence. So in this space, we have a number of important studies that are about to be concluded that will be used for engagement at different levels in terms of policy dialogue. United Nations University, we are so lucky and fortunate that it is located in Kuala Lumpur, and it's a long-standing partner to UNFPA here in Malaysia. Together, we have a study coming up on the consignment centers, which we hope will emanate important policy recommendations that will study also then how to cascade out to make sure that the best circumstances prevail for maternal and newborn health. We also have, are wrapping up actually the layout of a Harvard report that we've done with Harvard and the EPU unit, Economic Planning Unit of the Prime Minister's Office, which is really looking at the return on investment for a series of sexual and reproductive health investments. And without going into much detail on the findings, I can just anticipate to you, and we are going to be launching them, of course, going forward, is that there are extraordinary returns on investment too, leaving aside the human rights and the rights and the efficiency gains of investing in sexual and reproductive health and rights, and notably family planning and other women health rights issues. There are also an economic efficiency argument. So there is no excuse to not intensify investment in sexual and reproductive health and rights. So we are going to invite you to the study finder. With other agencies such as UNICEF, we have conducted families on the age, which is a longitudinal study you may have seen in the news, where we have seen how COVID has impacted, notably on the expanding the number of poor, notably in urban settings. We have also upcoming studies on the sexual and reproductive health situation in Sabah and Sarawak. So these are some examples of the evidence base that we are generating. I'm trying to keep my eyes on the comment box to see if there are engagements from you, so please feel free to relate. So going forward, we also aim to activate action. This can be to work together with implementing partners, civil society organizations, to provide training in cutting edge area so that we can better move the needle in terms of providing care for and healing from, for example, gender-based violence, and also the prevention of it actually happening. And in addition, we have a new line of work where we engage with religious and faith-based actors to expand the comprehensive sexuality education, including in Sunday schools. So that's just to give an example. And for those of you who are a bit tired, you may have been in many Zooms for the past 2 years, I apologize. I've tried to add some of the data so that you can take notice as well if it's interesting to you. Also in the context of the time that we have for this presentation. Next slide, please, Nadia. So just I did mention our study on Sabah and Sarawak. So while Malaysia has done tremendously well in some areas of sexual and reproductive health and made great advances, of course, there are pockets of underserved populations where we also want to focus our advocacy and our efforts, our evidence gathering, policy dialogue going forward, working hand in hand with the government and other partners. So the focus there on Sabah and Sarawak is an upcoming priority that can be expected for our work for the next 4 years. Next slide, please. We, as UNFPA, and I'm glad to know that I believe our resident coordinator, distinguished UNRC, launched this year's seminar series. As you will know, the UN is comprised of several different organizations. So us being the reproductive health agency, we are also the custodian of gender results in the UN country team in Malaysia. Being the representative agency with a clear focus on that. Of course, all of the UN agencies are mainstreaming gender into the work, but we are, for example, co-leading the gender results group in Malaysia, where we are making sure that as a UN team, we are moving forward together, both in terms of evidence gathering and normative supports and action towards gender equality and women's empowerment. Next slide, please. Another area, therefore, we have different ways of engaging with partners, and this opportunity is one in which I would love to hear from you as well. When we talk about thinking globally and working locally, I also think that it is our duty to think locally and feed back to our global work. And that is the unique position that we have, I feel, at the country level. Our privilege, our honor to be listening in to the people that we serve, to hear about their priorities. This is where the laser sharp focus of our work and our policy dialogue is, of course, in Malaysia and in terms of our policy dialogue with the government. But it is also true that it is our opportunity to convey those perspectives and make them heard in the global arenas. So in that sense, I believe that working in a country office, you're sort of, in a sense, a taker and an implementer of the global policies and frameworks. But at the same time, our ambition is to shape those frameworks and global commitments so that they squarely represent the needs of those who are actually left behind, and that we design our programs and policy interventions with those who are furthest from accessing them in mind, to redress all of the barriers involved. So that is just to say that I think the process of thinking globally and working locally is therefore an iterative process. And we, as development practitioners, as I view myself, are just agents on that line. And when I think about sometimes our personal obligation to listen in to the voices of those that we are actually serving, I think one of the challenges we are facing right now is to be able to hear in the streams of words, of information, of news that we are actually exposed to at each and every level. So to be able to listen in. And when I was looking at the word roots of the word listen, the etymology, it comes from the word actually to pay attention to. So I think we need to make that square distinction between what we are hearing, namely the flood of the news of the information, and then to listen in attentively to what we need to hear that can then prompt our action. And in addition, I was interested to see, you can go back, Nadia, please, to that slide, that when you look at that word again, etymologically from other translation of its word roots, it actually comes from it meaning to make famous or to make known. So I think that's a beautiful summary of what it will take to listen in to our very local work, namely, on the one hand, to pay attention very carefully to what we hear, and then to make known or make famous what we hear. Next slide, please. So that is maybe just to recap one of the other areas of our work, namely our advocacy engagement, our intent to accelerate awareness and activating attention or listening in to the issues of sexual and reproductive health and rights. So we have, of course, our social media line. We have our evidence base that I mentioned. We also have our global evidence base, such as the State of the World Population coming out towards the end of the month of March. We have our annual Malaysia Women and Girls Forum that I hope you actively attend. And then during, for example, the 16 days of activism to end violence against women, we are actively engaged to intensify awareness in Malaysia on this topic. So, for example, this year we oranged the KL tower, and we wanted it to trigger a conversation. So we are going to be trying to seek ways to work with you and other partners to actually activate that attention so that we can close in and end the unfinished business of sexual and reproductive health and rights in Malaysia, which is a human right for all, and of course, in the whole world. So with this, I want to thank you very much for your attention. Terima kasih. I don't know if Nadia, if Professor Pascal will allow, if you will prefer to take open question. If you would like or feel feasible, then I actually have a Mentimeter open if in case you would like to launch it to hear views back. So with this, I hand it back to you, Pascal, and thank you very much for allowing me on behalf of UNFPA this particular space. And thank you to everyone who has listened.
Thank you so much. Also, that was really informative and very interesting to hear. Now I have some questions here for you. You have given us at least half an hour, so some of it would be direct questions, but very much a conversation as well, if that is okay. So first of all, the sexual and reproductive health, as we know, is actually one of the areas that is often considered sensitive, right? And it's in fact an area where individual rights are very much challenged because, and you alluded specifically to bodily, some of the work that you're doing in bodily autonomy and so on. But it is, I mean, sexual and reproductive health, almost by definition, is partly about families and society and so on. So everybody has a sense about what I should do, what women should do with their bodies, because depending on the culture and so on, your bodies, they feel like the bodies belong to the society and the family and so on. So it's always, and they're almost always issues of tension. Can you talk, given your vast experience and the number of countries that you have lived in, can you talk us through, maybe giving us one or two examples of where you have had some major challenges in dealing with issues of sexual and reproductive health, and how you have managed them in terms of negotiation locally, as well as being able to draw on global evidence to be able to address them?
Yes, you're right, Professor Pascal, that unfortunately it is a sensitive issue. And it really goes to the heart and the core of our lives, I think. And as you rightly mentioned, it's a deeply private conversation. And I think everyone will have actually a view on it. So to take an example, for example, from Bangladesh, where I just recently joined from, as you were rightly and very eloquently mentioning. We have a very large program in Bangladesh. We have also a large humanitarian response. UNFPA was on the ground actually with a small.
Now I'm still trying to figure out whether it's my machine or whether also has frozen.
I can see you now again.
Okay, yes, you froze for a second there, if you don't mind. Yes.
So we had, over the course of a very short time, about 1 million of Rohingya refugees who were entering, and we had to scale up a very substantive response. Many of them had suffered, of course, from terrible sexual violence, atrocities of which I think we are all very familiar with. And so in addition to that, we had a very large national program in Bangladesh. So I will talk mostly about our experience from our national program, where actually in Bangladesh has some of the world's highest rates of child marriage, which of course is embedded in a cycle of challenges. And unfortunately, what we did see, but again, we didn't have comprehensive, conclusive data since COVID, but that the rates actually did go up also as a consequence of the school closures. So I think that is a very pronounced example of how the lack, for example, of family planning and unintended pregnancies, how it interacts with child marriage, which then locks girls into actually a lifelong position as members of their now husband's household, and also serving mostly as unpaid work in that particular circumstance. And as you also know, the risks of um, uh, actually maternal death in relation to early pregnancies or adolescent pregnancies is really high. So what we did there was, of course, to try to, were part of the global program to end child marriage together with UNICEF. And many of our investments were really around intensifying comprehensive sexuality education. And our entry point was specifically through schools, and also in madrasas. And I think it was absolutely amazing to see that we started it as a pilot, and it was a pilot involving 350 about schools, and then it was taken up as a curriculum the whole of the country. So there was, of course, even from a government point of view, um, there is the ambition to end child marriage. However, cognizant of many of the cultural factors that are posing the actual de facto reality constraints to achieving that. Other auxiliary measures that we took were, of course, social media engagement. We developed cartoons, a series of different kind of works to really try to find the adolescents and be able to activate their awareness of their actual right to not end in child marriage. And I had some of the memorable last missions in October before I joined Malaysia up into the north of Bangladesh to visit the schools and see how they had done, and to see some of the girls who had been empowered sufficiently to actually negotiate with local police, with headmasters, with their communities, with their parents, with the elders in their communities to defend the view that their sisters would not be married off. So those are the things, each and every girl that is saved is just such an extraordinary victory, and every girl that is lost is such a tragedy. So just come back to that being also a huge motivator for the work that
Yeah.
that
Great. Thank you very much for that. The other question that has come up is that one of the major areas of focus for UNFPA is the PBIT, which is around the population. And within this region, and I know in Malaysia in particular, one of the major areas that needs work is the care and issues for the aging population. Can you talk a little bit about the plans you have for working on aging here in Malaysia?
Thank you so much, Professor. Correct.
Please.
I think we have this peculiar situation. While on the one hand, of course, an aging population, then of course, an incredibly keen and eager young population. So we need to make sure that all people across the lifespan will be able to thrive at whatever point of life where you are. And as you rightly mentioned, it is really a pronounced feature in Malaysia, as in many other countries throughout the Asia Pacific region. So I may not be able to talk in details about our plans. Just for now, sufficient to say is that it will be an important focus area for our work. And we are right now engaging in trying to figure out exactly the type of programmatic interventions that need to be put in place. But I think one of the areas, of course, it's developed, but maybe it can also be further developed, is of course around the care economy and adding the peculiar, let's say, point of women's low labor participation, one of the lowest in ASEAN, adds also to this complicated nexus of the demographic kind of realities going in a little bit different directions, but certainly the need to get ready for an aging population and an aging population which can thrive and be valuable assets, of course, in society as they are.
Great, thank you very much. And I have one more, and can I just talk to the audience a little bit as well, and encourage you to continue to put questions through to Orsa. The next question that I have is how do you access the data that you use in the work that you do here in Malaysia? And what are some of the mechanisms through which others can engage with you and help you with data sources that they may have, and so on? I know we have quite a few academics on the line who would be really interested in working with UNFPA and engaging in some way.
Yeah, we do use, of course, data from the government and our partners and the Ministry of Health, etc. And of course, the accessible data that we have, for example, of GBV. So you're familiar, the data is quite scattered. We would love to be part of an endeavor in which we could participate in systematizing the data. We as well, I'm sure everyone on the call has seen the news. We also, of course, know that it may be based on partial data, but there is a tendency to note that the rates of gender-based violence are going up. So I think it's a promising situation we are in which this is debated. We hope to be able to be accessing and working towards collaborating and accessing the data. So I may not be able to say that we possess them, therefore, but based on the needs of the evidence that we will need to undertake, and I'll be very glad to discuss this bilaterally or also with others in the audience. Please feel free to come back to our team to see what we can do, because surely, as you know better than any other individual and also institution, evidence is a very powerful ingredient for successful policy dialogue. And also, to be quite frank, it is the sine qua non for our ability to talk about the progress or the results that we are making, or whether we are going astray from our plan, if we are on track with SDGs and so on. So it is very clearly very, very important. I think, in a sense, the COVID also held us back from a lot of data collection worldwide, and including in Malaysia. So now should be, I hope, a very good moment to intensify this collaboration to see what we can do.
Okay, great. So I don't have any formal questions yet. I'm still waiting for more from the audience, but if I can move it to a more conversational bit. You've been in Malaysia now for about 5 months.
Yes.
What are your favorite things so far?
My favorite things, it's my team in Putrajaya. It's not a thing, of course, but the work that we do together is what I love most. Other things that I really love and that inspire me deeply is the vegetation, the green. It's that's growing so much around us if we are going out, and the accessibility to us being able to move finally outdoors in the nature. Not also a thing, but I really do adore my meetings with the people of Malaysia. I think at the end of every day, I've just earned so many smiles, and they are just amazing. So I can't see the audience, but I just reminder to everyone, it's always good to keep on smiling. It's a good gift that we can give
Great.
to another.
Fantastic. I believe we have a question from Zoom from Christy Chong, who says, "Thank you for a wonderful presentation. May I know what are some perspectives obtained from Malaysia and other similar developing countries that have informed the global network in particular for uplifting women's rights from the working class?" So this is not going from the global to the local, but from the local to the global.
Yeah. We have, of course, the mechanisms that are so important where we work with civil society, research, think tanks, academia. If you mention, for example, the study Sabah Sarawak together with University of Malaya that we are doing, of course, that can influence our different contributions to regional frameworks that pass by our desk on a timely basis. As you know, only this year we have a series of very important high level meetings coming up. Of course, the MIPA review in July, ESCAP in Bangkok, gathering the world around also important topics such as aging, which will be one of those opportunities to bring Malaysia's voice to the global fore. The other opportunity is, of course, the meeting in Pattaya. You are familiar on the family planning meeting later in November, where I hope that we will have approved the possibility to have a panel to share the findings and the voices from Malaysia. And I'm sure other entities will also participate there. So I see us as a broker, and I also know that only next week the UNU will host a meeting at the Commission on at the CSW, so which is global. So those are also absolutely important opportunities to raise our voices that we can never miss out on. And on the one hand, while I think we have lost, of course, a lot of body and the transfer of energy and commitment by our virtual meetings, it of course has allowed us to also broker a lot of significant interactions and to broker the voices of the people that we serve. So I hope that that responded. But any advice that you have for what more we can do, how we can intensify our effort, will be really appreciated. And particularly when we will call you from the CPAP consultations, please engage with us. I would like to hear everybody's voice.
Indeed, I think that is a really important point. That in spite of all the complaints about Zoom and so on, it really has provided an opportunity to engage with a whole range of people who otherwise we didn't have the opportunity to have this kind of direct contact with. So that's really. If I can pick up on a point that you made, and you made it as part of your as the things that you like, the green, the environment here in Kuala Lumpur. There is the theme for a lot of the international days this year are focused on climate change, which is absolutely really critical. And the session that we have next week that you mentioned is about just trying to bring the lessons from the sexual and reproductive health area into being able to tackle things like climate change and so on. Is there a climate change agenda yet for UNFPA? Is there a sense of how you will be engaging in that space?
Thank you for raising that. And you will recall that on the 8th of March was International Women's Day, and we actually dedicated it to gender and climate change, which was an excellent opportunity together with the UN family as UNFPA and also as therefore lead of the gender results group to touch base exactly with a lot of these local and other voices to hear what the needs are. So it's very good that you mentioned this particular point, and in the past we have not had a pronounced agenda. I'm very committed that we do, and actually only yesterday, together with our country offices in Thailand and Maldives, which with Malaysia have very different kind of positions in the global vulnerability indexes, but we cannot exclude that it will become even more important for Malaysia going forward. So certainly we want to gear up and enhance our preparedness. So our meeting yesterday was internally with our regional office to set up a minimum preparedness action plan for Malaysia. So I think those are some of the actions, and we are going to be looking to see how we can partner to anticipate and not be reactive. But I think it's unfortunately predictable that in any case, we have learned from also from COVID that be it the stressors that the environment is provoking or others, it has taught us for sure to be agile and to be ready for everything. And there is no harm in being ready and starting to prepare. So I'm going to be interested to see if we can, for example, start looking at, for example, what would securing women's dignity mean for Malaysia? What could the local construction of a dignity kit, which is a signatory UNFPA provision in humanitarian circumstances, what could it look like in Malaysia? To start that thinking and correspondence and have some planning in our plan going forward to at least have the readiness in the beginning of the year. Then, if we are lucky to go to year end with no stressors, that would be amazing. And then we can spend that investment, of course, elsewhere. But I think it's wise to be prudent and be ready for to navigate changes. Yeah.
Okay. Osa, we're coming close to the end of the session. This is a final opportunity for any last words before I wrap up.
So thank you. That is really amazing. It's been a wonderful afternoon together with you. As I said, I hope it was worth the while. You have invested now 1 hour. That is 1 hour less towards us reaching together the Sustainable Development Goals. I think what we did see, for example, recently, Malaysia also emerging as one of these countries which is very a very fertile ground for foreign direct investment, for example. As we are looking for moving from the funding situation to more sustainable financing, I think this is where our attention needs to be as well, to make sure that these opportunities that are also present right now, along with the challenges, can be capitalized, and that we can together squarely integrate the sexual and reproductive health agenda and the appetite to close in on the remaining gender-based targets and the gaps together, and to make the adequate investments to reach those targets. So I think this was a very brief overview of the work that we do in Malaysia and the work that the plans that we have for the future. And just to reiterate once again, I would like to encourage you and really look forward to you reaching out to us, to me, bilaterally with ideas for partnership, what more we can do, what we can do differently, and any new partnerships that we can have. And also to be very actively engaged with our country program, action plan, document process, which is going on right now. So once again, I thank you, Professor, Director Pascal Alotay. I thank your team who has been helping, and I thank all of the audience for your attention and for listening in to this presentation this afternoon. Terima kasih.
Thank you very much. Also, a very easy, very, very easy hour to have spent. Can I encourage everyone on the line, please, to stay tuned for the UN country team webinar series on Working Local, Thinking Global. We will have the next one advertised soon. And let you know what's happening. It is your opportunity to engage with the UN, which is all of us. I keep reiterating this point. It's not an us and them. We are all part of it. It belongs to us. This is an opportunity to engage and engage actively. So stay tuned, and we will see you soon. Thank you so much, Osa. Very grateful. And thank you, everybody. Have a good afternoon.